Hope all okay on your part, friends. I'm Dr. Arshad Nadeem Awan again with my ultrasound and radiology teaching video. Today I'm going to talk about the microcalcification which you can appreciate on the mammogram. There are microcalcification which may be benign or may be malignant. So today I'm going to talk about particularly benign calcification. If you come across benign calcification, what it would be and how it would look like. For example, if there is any vascular abnormalities, it may give rise to a trend line calcification, which is benign. If there is any ductal ectasia, it will also appear as an broken needle calcification. If there is fibroadenoma, it will also appear as an popcorn calcification. If there is abnormality related to the fat necrosis, it will appear as an eggshell calcification. In some other condition like in skin calcification and inflammatory calcification, there will also be a particular style and particular shape and characteristic of the microcalcification. How we will appreciate on the mammogram images. So let's start watching these images. On the mammographic imaging, calcifications happens to be either benign or malignant. Today I'm going to discuss about the benign small calcifications on the mammography. So before going to talk about and to see the images, first we have to look how many reasons and what are the causes of these small calcifications on the breast mammogram. So the first and topmost is a normal stroma. Sometime if there is a normal stroma, you may be able to see calcification over there. And next come is fibrocystic changes. If there is any fibrocystic changes take place in the breast, so this may lead to small calcification. As you know that the breast is made up of multiple duct and ductules. If there is duct and ductule ectasia, so this may result into calcification formation. Due to any reason, if fat necrosis occurs, so because of the fat necrosis, calcification will also be there. Fibroadenomatide hyperplasia may also have some sort of a calcification. Fibroadenoma may be having calcification in it. Papillomas, these are some benign tumors in which there is calcifications are likely. Vascular calcification may also present on the mammography. There may be a skin calcification, so calcified plaque of the skin can also be visible on the mammograph. And if there is any atrophic breast lobules, so this may also leads to the formation of benign microcalcifications. On the mammograph imaging, vascular calcifications may likely to occur. It would be appearing as a tramline appearance, mean like calcification of both walls of the vascular. So here on these mammograph images, these are MLO views of the mammogram, and on this mammogram you can appreciate the tramline calcification. These are not pathological, these should not be considered as malignant, these are benign calcification, and this is because of the vascular calcified wall. So because of the vascular calcified wall, both sided wall will appear as a tramline calcification. So this is what the benign calcification appearance would be on the mammogram. Another craniocardial view, you can appreciate tramline calcification as well. But beside this, next to this CC view, you have a magnified views, and on the magnified views quite clearly visible tramline calcification can be seen. These are vascular calcification, these are benign in nature, and it has no relation with the malignancy. So sometime vascular calcification may appear as a tramline calcifications. Another benign presentation of the calcification would be ductal ectasia. If there is ductal ectasia, it will give rise to a broken needle appearance of the calcification. Usually it would be bilateral, it would be coarse and dense rod, and it would be branching calcification with well defined margins. It would representing as calcification of debris within the dilated duct, and this is usually seen within the anterior third of the breast. So this would be benign calcification. Another presentation of these ductal ectasia would be a lead pipe appearance. For example, if debris is extruded from the ducts into the adjacent parenchyma, then an inflammatory type reaction can occur with fat necrosis calcification, then take on this characteristic appearance. So like it may appear like a broken needle, which you can appreciate on these images. It will appear like a lead pipe appearance, which will comes out of the duct and it will penetrate within the fatty tissues, which will leads to inflammatory response, and again this will give rise to a calcification. So these all three stages, three form would be benign stages, and it will give rise the calcification, which again would be macrocalcification and would be benign in nature. Next comes another benign entity, that would be milk of calcium. So sometime in fibrocystic changes there will be sedimented milk of calcium within the microcyst. So this will appear like the way you are seeing that it is surrounded by the by this circle. So for that you have to have the CC view, like it would be a round smudge shadowing or a lateral magnification view, a characteristic teacup sign due to calcium fluid level layering of calcific fluid within the microcyst. This will give rise to, but for that, as we mentioned, that you have to have the craniocaudal view and you have to have the true lateral view. But on that image which is visible to you, it shows a characteristic feature of the fibrocystic changes and sedimented milk of calcium within the microcysts. On this mammographic view, again you can see this sedimented milk of calcium within the microcysts. So it will appears like that, the way you are seeing on this mammographic images. Fat necrosis will give rise to a particular presentation. It would be like an eggshell calcification. Here on this image you can appreciate very clearly, indicated by the black arrow, this is called as eggshell calcification, and this eggshell calcification is usually seen in fat necrosis. In some of cases it will also be in the wall of oil cyst, but here this fat necrosis gives rise to particular eggshell calcification. Here is another view. Here you can see multiple eggshell calcification indicated by the white arrow. These are fat necrosis and this is quite common. If you come across such calcification, you should not bother, you should just label it as a benign calcification and it would be benign microcalcifications. Very beautiful presentation on the mediolateral oblique view. This calcification is called as popcorn calcification, and this popcorn calcification is usually seen in fibroadenoma and it's occurring especially after the menopause. Occasionally any calcification is small and punctate. Usually you will see popcorn calcification, which is quite clear on that image, and that is in fibroadenoma. In fibroadenoma, popcorn calcification would be benign, as fibroadenoma itself is a benign tumor. Another example for the fibroadenoma, and here in view the calcification which you are seeing, this is popcorn calcification. It's coarse in nature and it is usually appear as an popcorn appearance, and you will be able to see this quite common in menopausal patients. So the menopausal patients will be having a fibroadenoma and will give rise to a popcorn calcifications. There are some other calcifications occur especially in fibroadenomatoid hyperplastic conditions, where you will be able to see some microcalcification, but these microcalcification would be of non-specific appearance. There is no specific appearance for the microcalcification which confirm that this is a fibroadenomatoid hyperplasia, as like in fibroadenoma you have a popcorn, and in fat necrosis you will have a axial calcification, and in ductal ectasia you will have a broken needle calcification. So all these calcification have its own particular conditions. As far as fibroadenomatoid hyperplasia is concerned, there would be calcification, but these calcification would be of non-specific nature. There are few other conditions in which you will be able to see the calcifications, like in skin condition there will be some skin calcification if someone is using deodorants, talcum powders, or they may have tattoos on their body, so it will mimic as in microcalcification. So one should be very careful for all these things, and especially at the time of mammograph you should have to have very careful while if patient has any use or patient have any talcum powder on her body, or if there is any tattoos, it may mimic as a microcalcifications. Because of any surgery or any other condition where there is need of applying any suture material, so if there is suture material which would be calcified, so it would appear as a dense curvilinear calcification. Here on this image, this is a craniocaudal view, and on this craniocaudal view you can appreciate quite dense and curvilinear calcification, which is actually calcified suture materials. So this is again another slide which is explaining calcified suture material. On this view you can see that there is dense and curvilinear calcification, which by nature you can quite commonly and confidently report on that this is calcified suture material, and the patient history will also explain that, and the type of the calcification will be able to explain itself. So you come to know that there are certain calcification like fine needle calcification, or tram line calcification, or popcorn calcification, or axial calcification. So all these having very particular appearances, and you may be able to identify what is the reason behind, but in one way or the other you had, or at the end of the day you have to label it as a benign calcification.